So today I'm going to show you the hooded technique for IV insertion. First, I'm going to show you what supplies you need. So you need gloves since you're working with body fluid, a tourniquet, alcohol pads, tape, a loop with an IV flush, and then you're gonna need your IV catheters, and they come in different sizes, and the sizes work kind of like shotguns. The smaller it is, the more powerful or bigger it is. So 18 is gonna be pretty big, and then 20, 22 are your most common, and then 24 if you have somebody really with a small vein. And then your tegaderm. So first I'm gonna teach you how to properly put on a tourniquet. I'm gonna show you the technique, but first I wanna go over that you only need one tourniquet for IV insertion, and really ever if you're drawing labs or anything. You only need one tourniquet to get the job done. Never put on two, because remember, we're not trying to occlude arterial blood flow, only venous. So here we go. So first, the best way I've learned is to basically cross your arms and make sure there's no wrinkles under the patient. Get your strap laying flat, and then with this hand you're gonna pull, and then you're gonna pull this hand and basically make a cross, and then with your cross there you have the leverage to pull up and tuck, and then your tails are facing up like this and they're out of your way so that you have a nice workspace.
So before I actually show you guys how to insert a catheter, I wanted to actually talk you through the steps of the hooded technique. When the nurse first showed me this technique in vascular access, it really blew my mind, but overall it's a better technique in my opinion, and less messy overall. So first, of course, you're gonna put on your tourniquet, and then you're gonna find the vein that you want, and then you're gonna hold traction with your other hand that is not inserting the catheter, and then you are going to stabilize your hand with your other three fingers that are not in use while holding your catheter with your pointer finger and your thumb. You're gonna make sure the bevel is up on the needle, and then you're ready to insert. You're only going to insert at a 15-degree angle, and you're gonna pierce through the skin and into the vein. You only want to basically get your bevel in the vein, and that's whenever it will show you a flash of blood to let you know that you're in the vein. At that point, you're gonna stop. You've got your flash. You're actually gonna drop your angle down to the skin so it's flat with the skin, and you're gonna advance the needle ever so slightly, probably just 1 millimeter. Then what you're gonna do is you're gonna take your finger and find the notch on that plastic catheter, and you're gonna slide that catheter up about 2 millimeters. What this is gonna do is that plastic catheter is going to basically hood the needle. Therefore, it's safe to advance the whole unit forward. This allows you time to grab your supplies without blood dripping from the end of your catheter. So to show you guys what this is actually gonna look like, I have a few simulated materials. So here I'm going to advance the needle bevel up through the skin and into the vein. You will see that here. The green part is the needle. You can see it's bevel up. And then I will advance the catheter tip with my finger over the end of the needle, which is hooding it, hence the hooded technique. Then The end of the needle is hooded and I'm able to advance the whole unit forward into the vein. You guys, this technique really floored me when the nurse showed me this. I was like, really? Push the whole needle in? It was like, why would I do that? Wouldn't it be hurting the patient? But then the nurse showed me, just kind of like I just demonstrated for you guys, but she used the actual thing to show me. She showed me that the end of the catheter actually hooded the needle to allow the whole unit to be guided into the vein. The needle basically now is acting like a plug, and it won't allow blood to escape from that catheter now. So it frees up a lot of time for you to grab your loop, get that primed if you haven't already. And I think it's just a less stressful way to insert an IV.
Okay, so now I'm actually going to show you how to put the IV in with the hooded technique that I showed you earlier. First, you're going to do hand hygiene and put on your gloves. And then I would advise you to get all your stuff ready. So I would attach your saline to your loop and get it primed, have it set in here, the cap's on, and that end is sterile. I would get your tape ready for when it's over. Maybe set that on the bedside table so you can quickly grab that. And have your tegaderm here. We have our alcohol, and then we have all of our sizes. Today I am going to use a 22 gauge. That's probably the most common that you'll see. So we'll just go ahead and get started. I'm going to open this up. Have that here. So as I showed you before, we have our tourniquet on. This will allow us, since we have it above the AC, we can analyze all these veins down here to see which one we would like to stick. So you can run your finger like this across it, see if you find a vein, and then kind of like this, and see if you can like feel a bounce almost.
Another thing to remember here is to always avoid veins in the wrist. So to show you this, use your 4 fingers on your left hand and cover up your wrist on your right hand, and that is the area that you should avoid because this has a lot of nerve fibers and only a skilled professional should stick this area if needed.
So I think I will go with this one, and you can see here how it kind of runs this way, so I will be inserting the IV this way so it runs with the vein. So first you have to clean your site. You're gonna start in a circle and clean out. Okay, then you have your IV. Just pop the top off here. So you want to hold it kind of like this, and then one of the biggest things is to hold tension on the vein. So you're actually going to use your pointer finger to hold tension on that vein. I'm right above it, and then use your thumb to kind of pull down and pull traction.
Something to remember here is that you never want your thumb to get in the way of you sticking the needle into the vein. So always make sure your thumb is out of the way and you have a clear area that you are able to freely stick.
Not on the vein, but the skin, pull traction. And then you're gonna take your IV and at a 15-degree angle, you will insert and see your flash of blood, and then advance your catheter and then advance the whole needle. So I'll show you. So you're gonna steady your hand, and then you're gonna go in at a 15-degree angle.
Here's a good spot for me to remind you guys that the only pain your patient should be experiencing is the pain whenever you push the needle through all the layers of their skin. However, once you get into the vein, they should not be experiencing any pain at all. If they are experiencing pain, it's likely you're doing something wrong.
So and then you're gonna drop your needle, advance it
Ever so slightly. And then you're gonna slide this about 2 millimeters so it hoods the end of that needle.
and then you're gonna just take the whole thing and slide it in.
Once you have it in like this, you can literally take your hand off and then leave it just like that, get your loop ready, and there will be absolutely no blood coming out.
Pull the turn.
Once you're ready to add the loop, just use your pointer finger to occlude the vein.
Make it. Grab this. It's gonna retract for the safety device. I'm going to grab my saline lock. This end is sterile. Push it in there, and now that it's in there, I can let go.
So as you can see here, that was a super easy technique. I feel like it's way less rush to get your loop attached to the catheter, and the best part is you have no mess with blood dripping out.
And screw it on. I'm gonna draw back, see if I get blood return, and I do. And then I'm gonna flush, and I'm gonna watch the site down here and make sure that I don't see fluid going into the interstitial space or infiltrating. And I just wanna see how easily it flushes too. And there we go, it flushes easily. So we're in the vein, and I'll show you how to tape next. So now I'm gonna show you how to secure your catheter. You're gonna rip off a piece of tape about this long, and then you're gonna wanna rip it in half, and then have your other tape over here. The first piece of tape is going to go, if you can see on this catheter here, there's a little notch here. You wanna put it below that notch and just secure it down. And then you're gonna take your other piece of tape, and you're literally gonna put your 2 fingers like this, slide that up under here, and you can either do what's called a chevron or a U shape. So I'll show you the chevron first. So you're just gonna hold the tape here, because I know it might be kind of hard to get it off a glove finger. So you're just gonna roll your finger, get it off that tape, and then I'll show you the chevron. So you're just gonna cross here. And then you're gonna take this hand, just roll your finger off and chevron it right up here. And that's called the chevron method. And then with that, you are just gonna take your tegaderm. We're not gonna use the tegaderm on this simulated arm because it gets kind of sticky. So you're just gonna put the end of the catheter tip, you're gonna center that in the middle of this, just like that. And then you'll have that down. So now I'm gonna demonstrate the U method. It's just like the chevron method. You're gonna tap your piece of tape like this, get it in your hand, slip it up under here, get it right up adjacent to that other piece, hold it with this finger, roll off this hand, and then you're just gonna literally come up like this, and then get it off this finger, roll off, and come up like that. And then put your tegaderm on, secure this and you're good to go.
I hope you enjoyed this video. I learned this technique when I was in role exploration with vascular access, and I'm so thankful for everything they have taught me thus far. And I just wish you the best of luck starting your IVs and in nursing school. See you guys.